Welcome to UMCC Medical Consultants Connectors. Ever been caught off guard by a sudden, uncomfortable sensation while urinating? It's a situation no one enjoys finding themselves in, and yet it's a common experience for many. The culprit? Often it's a urinary tract infection, or UTI for short. But what really causes these pesky infections, and how can we prevent them? Urinary tract infections occur when bacteria invade the urinary system, which includes your kidneys, bladder, and the tubes that connect them. When these bacteria multiply, they can cause an infection, leading to symptoms like a burning feeling while urinating, cloudy urine, or even lower back pain. Now you might wonder, how does this bacteria get into the urinary system in the first place? Well, there are several ways. One of the most common is through improper hygiene. Wiping from back to front, for example, can introduce bacteria from the anal region to the urethra, the tube that carries urine out of your body. Another risk factor is sexual activity, which can push bacteria into the urethra. This is why it's often recommended to urinate before and after sexual intercourse to help flush out any lingering bacteria. Certain conditions can also increase the risk of UTIs. For instance, being diabetic can make it harder for your body to fight off infections, including UTIs. Menopause can cause changes in the urinary tract that make it easier for bacteria to take hold. And having a urinary catheter can also increase the risk, as it provides a direct pathway for bacteria to enter the urinary system. It's also worth noting that while everyone can get UTIs, they're more common in women. This is largely because women have a shorter urethra than men, which makes it easier for bacteria to reach the bladder. So how can we protect ourselves from urinary tract infections? Good hygiene is key. Remember to wipe from front to back, and always empty your bladder before and after sexual activity. Staying well hydrated can also help flush bacteria out of your system. And if you're at a higher risk due to a condition like diabetes or menopause, talk to your doctor about what you can do to protect yourself. In summary, urinary tract infections are caused by bacteria entering the urinary system, often through improper hygiene, sexual activity, or certain conditions. They can cause discomfort while urinating, among other symptoms, but with good hygiene and regular doctor visits, they can be prevented and treated effectively. So the next time you feel that familiar discomfort, remember, understanding is the first step to prevention. UMCC, your ultimate medical guide. Subscribe and share.